Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib, and I'm joined by a wonderful guest and good friend, Dr. Chris Magryta. How are you, sir?
It's a pleasure. Nice to see you again. And we're both talking offline about the wonderful weather we have. So
yeah,
nice to be indoors today.
Definitely in a sarcastic way talking about that. We are very excited about this topic because we haven't gotten into the idea of pediatrics very much. And I want to get into this with you because what we're going to talk about today is this mismatch or this paradox that is currently existing in the pediatric health environment and what we can do to help optimize pediatric and maternal and paternal health in such a way that we develop a stronger generation in the future. And that's really what we and you have been really focused on is how do we encourage and initiate a positive development cycle for our kids so that they're not suffering from health conditions of various forms in the future. I want to first get people to know a little bit about you and get to know about your history in becoming a pediatrician. What really drew you to helping kids with their health in the first place?
That's an easy story. So med school takes me down to Atlanta, but Emory, loving learning. I thought I was going to be internal medicine doc. Absolutely loved the science that I was learning there. Jumping around from field to field, neurology, endocrinology. Nothing interesting enough made me happier than switching field to field to field. I just loved them all. But internal medicine seemed the way to go until I realized adults didn't want to heal. And it was very distressing to be at Grady Memorial Hospital in Atlanta and seeing these patients and realizing that invariably their desire to change was minimal. And it really frustrated me. And despite good education, everything, it seemed to be the people had tended to buy into a pill for an ill. And that's what they were looking for, whether it was antibiotics, this, that, or the other thing. And so I really wasn't thrilled with that. So then when I shifted over to my pediatric rotation, I realized I found home. And why that was because kids want to be healthy. You know, the classic story is the child with cancer, and they're walking around the hall. They want to get out as soon as they can. There's no interest in being stuck in a hospital. There's no interest in having disease. If they have their way, they're constantly going to want to run, play, and enjoy life. And I fell in love with that. And I felt like there was a better opportunity to make admirable change in the life of a kid by being a part of that environment and not being a healer, but helping them see the path to healing is what I really learned. And so I fell in love with peds, did my rotations and said, yep, this is me. And then got accepted to University of Virginia's program and absolutely had just a dream of a time there for 3 years. And I realized I was where I was supposed to be. Then the tricky part was figuring out if I was going to do subspecialty medicine or go general peds. And I realized by my personality that I would never be satisfied if I didn't keep the net as wide as possible. So I chose general practice. And that's been, luckily for me, the greatest decision I ever made.
I want to ask you about how you went from general pediatric practice in an MD-focused kind of trained mindset into a more integrative functional approach. What were some of the things that happened along the way that helped you make that shift?
Running into brick walls. Simply, your general pediatric practice, we're a large group, 70% Medicaid, so lots of SDN, social determinant of health needs, lots of kids would struggle. And you find over and over again that what you ended up having to do is default back to the pharmacological therapy instead of being able to really get into root cause. Why? And my wife was a nutritionist. She's an RD by training. We met at UVA, and it was very clear that all the questions she was asking me regarding how did food affect this, I had no answers to. And I was very frustrated that I was poorly trained in nutrition and poorly trained in preventative medicine. And so at that time, I had a partner who was following Dr. Andy Weil and came to me one day and said, hey, this guy Andy Weil's running a fellowship in Arizona. I was like, yeah, my wife likes him. I don't know much about it, but show me. So she showed me and I'm like, yeah, it's interesting. And so my frustration ran into that possible outlet. So I decided to do that fellowship. And from 2006 to 2008, I spent 2 years studying under Dr. Weil at his teaching program and had an unbelievable just a frame shift mentality where the blinders of conventional medicine now were taken off. And now I struggle because now I have this entire new way of seeing the world, that there is a way to stem disease, there is a way to change the outcome of the trajectory of epigenetics. But I was still stuck in the framework of modern medicine. That was very daunting. And so, yeah, that was where I was at that point, and that was 2008. And so I've been building that resilience mechanism of trying to learn how to do functional integrative medicine in the traditional world, which I've never left for the better part of the last almost 20 years.
It is a very challenging kind of line to maneuver between, because you're trying to provide really good medicine in a model that doesn't thrive on providing the best possible root cause focused therapies. And fortunately, I think there are some benefits to having an administration that is enabling some of these changes in some capacity. I'm not here to talk politics, but I'm very much interested in this idea of, can we shift medical practice to focus on nutritional, lifestyle, environmental, epigenetic factors? Because the rates of disease, particularly in kids, but across the board, chronic disease rates are up in virtually every category. And I think this is an important time and a very important topic for us to dig into. You are in the process of completing a book right now on the topic of this pediatric health paradox. And I would love for you to explain what this paradox or this mismatch is. And let's dig into the kind of nitty-gritty of this conversation. What's going on with pediatric health?
So I think if we're going to do that, we have to sort of go back in time and discuss Darwin and Lamarck. For most people, everyone understands Darwin. And what basically he said was that change in the human species occurs through natural selection. And that occurs by a mammal dying before it procreates. Essentially, for some reason or another, the environment that animal finds itself in is mismatched to the ability to survive and procreate. Therefore, that gene dies out. And the gene that doesn't die out propagates, and that species continues based on whatever genetic paradigm that is. And that was the guiding principle up until the epigenetics movement. And Randy Girdle, who I've spent a lot of time talking to, sort of proved Lamarck. And Lamarck, Jean-Baptiste Lamarck, was a contemporary of Darwin back in the 1800s. And he said, I don't think that's entirely true, that natural selection is the only means to which a species changes, right? And he said, I think there's things happening while you're alive. So your neck might stretch if you're a giraffe to try and reach those leaves that are higher, or you might change some other function of your body in order to meet the needs of the environment you find yourself in. If it was given enough time and that change occurs, that then would lead to survival. And then Darwinian theory would kick in. So you have both. And I think that was the answer. Darwin was a complete, Lamarck completed the story. And this happened when Randy Girdle did his seminal work in the agouti mouse. And so for your audience who doesn't know what the agouti mouse model was, this was a mouse that was set up to be overweight, yellow coat color, prone to diabetes and prone to cancer. And his first postdoctoral fellow, a gentleman named Robert Waterland, was a nutritional biochemist. And Rob Waterland said, what happens if we give these animals, while the mother is in her pregnancy phase, a group of methyl donors, which is a carbon atom with 3 hydrogens on it, and see what happens. And this comes from natural food. We're talking beets, we're talking spinach, things of that nature. And see if it could change anything in the outcome of the fetus. Well, it turned out that when they gave increasing volumes of these methyl donors, they put sticky notes on the upstream regions of the genetic code. So when I was in medical school, we had what's called exons and introns. So your DNA was this long strand of beautiful Watson and Crick laid out information, like your Bible of information. But there was the coding region, which was called the exons, and this thing called the introns, which are the junk DNA, which meant nothing, didn't do anything. Well, this is the beauty of medicine. We realize everything that we call idiopathic or junk just means we're not smart enough to know what it actually was. Well, it turns out that's the upstream coding regions that says, read this gene, don't read this gene, read this gene, don't read this gene. And when they did the genome analysis, we thought humans would have millions of genes. And humans only had around 21,000 genes. A wheat, for example, has 150,000 genes. How is that possible? We're this complex being with 21,000 genes, but a wheat stalk has 150. Well, it turns out this intron, this exon, this area of upstream ability to say read or not read gives us so many millions and trillions of permutations that we only needed 21,000 genes to become this complex, adaptable creature that we are. Well, Randy Journal's group, when they did this research, gave these methyl donors on these upstream regions and put sticky notes that says, don't read this gene. When the babies came out, these mouse babies, they were now no longer yellow coat color. They had a mixed coat color or brown coat color. They were not prone to diabetes. They were not prone to cancer, and they were not prone to obesity. So this was completely telling Darwin he's wrong, right? It is not just natural selection that does this. And this was earth shattering in the world of science, because this was the first time we had hope that we could change the outcome of humans through manipulation of epigenetic loci, or what's happening upstream of these genes. I learned this from Jeff Bland's Synthesis podcast when I listened to him talk to Randy Journal. And then I went my own path to find Randy and talk to Randy. And I said, oh my God, this is game changing for pediatrics, because this is now the first time we can actually say, let's go upstream and find the why this is happening. And can we unwind the why and go back in time? And so that to me was the biggest thing. And then the second part of the story that I think has to be told is Dana Dolino. So another postdoctoral fellow, and Dana Dolino was a toxicologist. And Dana said, what happens if we keep giving the methyl donors, but now we give a hypomethylator, something that does the opposite? And that was BPA, this plastic that was in baby bottles and in so many of the things in the early 2000s and late 90s. And lo and behold, the animals came back out yellow, obese, prone to cancer, prone to diabetes. So this was now the hope pain story. There's hope, but there's also pain. If you don't get rid of the negative inputs, you're in trouble. If you get rid of the inputs with positive inputs, then you're in success. So from a pediatric perspective, I see this now as, okay, what can we control in this seesaw of paradigm, good, bad? And so I look at this as a Darwin-Lamarck DNL ratio. How much of it's Darwinian? So this would be the hardwired genes of, let's say, trisomy 21 or level 3 autism. And how much of this is Lamarckian, epigenetic phenomena that we can alter? And this gets into the whole discussion of all these neurodevelopmental diseases and everything else we're talking about.
Yeah, we talk about epigenetics pretty often on the podcast. And I think you're absolutely on point when you say that this particular topic is revolutionary or an absolute game changer, particularly in a pediatric setting, because not everything is set quite yet. Development is happening. The new epigenetic factors, the environment is just taking root. We haven't developed patterns quite as yet, the same way that adults have when we're working with the child. And so for me, I think that is where these critical windows or critical opportunities are available to set kids up for a successful, healthy life. And I see where you're coming from in that particular area. What you're discussing here is a mismatch between the genetics and the environment. And I think that is ultimately what we need to start to work on, is creating or recreating that matchup that we are meant to have from the genetic profile that we currently exist with. Does that sound like a reasonable take?
Yeah. And people often use as a polar bear in the desert scenario, right? So if a polar bear with all that wonderful blubber and fur finds itself in the desert, it's not that the polar bear is genetically dysfunctional. It's that the polar bear is genetically dysfunctional for the environment it exists in. And so the corollary in humans that I think I can use often is skin color and location on the planet. If you think about for most of human history, 3 million years, most people who had darker skin color lived in a hot sun direct climate. Most people with very light skin would have existed in a northern polarity where the sun is not so hot and direct. And so you'd need a lighter skin to absorb more of that vitamin D through sunlight and not reflect it back. The darker skinned individual would therefore be closer to the sun in the equatorial area. So you'd want to reflect more of that sun back because you don't need as much, but still get adequate vitamin D. So you flip that now to modern America. We've moved all over the world, right? So somebody from equatorial Africa or Australia or South America who has much darker skin could now live in Boston. Well, what's the mismatch? Well, that skin is far too dark for the location that you find yourself in. And so your risk is vitamin D deficiency at a crazy level, not cancer, but vitamin D deficiency. You flip the other side of that coin. So somebody from, let's say, Northern Europe moves to North Carolina, where I live. Well, we are the latitude of Tripoli, Africa. It is a very hot sun and very intense most of the year. So what's your risk? It's not vitamin D deficiency now, it's flip-flop. Now it's cancer. And so this is the polar bear in the desert scenario. And this can be permeated through any gene that doesn't align with the environment you find yourself in. And I think the biggest issue with genes and environments now would be something like nature wants us to be fat, the book by Rick Johnson and the fructose story. The fructose ingestion is a beautiful thing if you're trying to survive a period of famine. And that's what humans did for most of their existence when food was a scarce commodity, right? Now we find ourselves eating fruit all year long. This is not historically normal. So therefore, what does that fruit do? It turns on a set of genes inside the liver that leads to fat deposition in the liver, fat deposition in the periphery, elevated blood pressure, and foraging behaviors. That's a beautiful thing 1,000 years ago. Not now. Now it leads to metabolic syndrome, obesity, and many other things that's killing us as humans.
Yeah, you're absolutely hitting the nail on the head here. And what you're saying is I shouldn't be living in Toronto, and I will agree with you on that. Toronto is cold, and for 4 months of the year, we don't see the sun very often, and we don't get to go outside as much as we want to, and the skin exposure is not there. And on your side, you should be in a more northern climate. And yes, these are genetically favorable environments, I think, for where we stand. But we're in a globalist society now where transportation is absolutely open to virtually everybody, and we're able to go around and make moves for economic benefit. And we've done so for probably the last 50 to 100 years. This movement of human beings to different places for economic benefit has benefited quite a lot of people, right? People that were in dire straits, people that were in war-torn regions were able to come to countries that there was more safety, there was more benefit. That's exactly kind of how my family ended up in Canada. Same exact idea, right? We had issues in East Africa and in Southeast Asia, and my parents said for economic opportunity and for safety and whatnot, Canada provided opportunity. They were immigrating, wonderful. So now we're in these environments and we have a bit of a mismatch. You're absolutely right about this, that genetically, I may not thrive best in a northern climate. But how do we start to live within the environment to make it work a little bit better? Because what you're saying with the Lamarckian side of things is that we can adjust, that the epigenetics component is something that we can make changes and enable optimal environments and optimal health through that, or at least get close towards that side of things. So let's talk about the conditions that are more often, particularly in a pediatric population, going to show up because of these mismatches in the first place, and then we'll get into what we can do about those things.
Yeah, and I agree with you entirely. The technological benefits and the societal benefits of the globalization of movement is a brilliant thing. And so to your point, it's not to shun that ability. It's actually to embrace it and say, okay, now that we have mismatches, are there things we can do to leverage those mismatches to make them functional again? And I agree with you entirely. If I was going to pick out two levers, right, there's many levers to pull on from a epigenetic mismatch. Right now, I would pull on two levers. I used to say nutrition was lever number one and mental stress was lever number two, but I'm now flip-flopping that. I think the greatest lever to human dysfunction is the mental stress of life. And the second greatest lever is the nutritional lever. Now, you can use the Canadian ice storm, being that you're in Canada, is probably one of the greatest examples of that in 1989, I think was the year. This prolonged period of time where a Canadian ice storm pushed people into a very stressful situation mentally and physically, where they had no access to heat, electricity, food, many things that would be necessary. And when they looked back at that data and found that the women who were pregnant during that time, their children ended up with higher levels of autism, right? And why would that be? Well, again, going back to the epigenetic Lamarckian story, that's telling the child while you're pregnant, there are signals being sent to the placenta, to the child, that this is going to be a very arduous world. So therefore, a certain set of genes would then elaborate to prepare for that arduous world. Why would that turn into autism or some other ADHD? We don't know, but we know that that actually is true. And so fundamentally, we want to sit here and say, okay, what is going to potentially stress the human and how do we unwind those things to protect it? Like, so I think about Native American populations who had a ethos that you protect mom while she's pregnant, you protect children when they're young, you do everything you can to give them the least mental stress that they could possibly have. That's what we're talking about. That's what, in this country where you have this big push for social determinants of health, right? The push to help people have less day-to-day stress. That's what we're talking about. Reduce the inputs that drive epigenetic change to tell the baby or tell the child when they're born that this environment is inhospitable to your health. That is something that we should be pushing towards. When it's the nutritional aspects of things, we know very clearly what foods drive dysregulation in the body. So from a societal perspective, we should be saying sugar is out. If you want to buy it with your own money, fine. But the government should not be involved in promoting any form of processed food or sugar to children. And the greatest, as Rob Lustig says, the largest fast food company in the world is not McDonald's by far. The largest fast food company by far in the world is the United States School Food Services. They dwarf McDonald's. Like a friend of mine recently showed me a picture of a child's lunch. It was a funnel cake, chicken tenders, juice, a muffin, right? That was the kid's lunch. This is not sustainable for mental health or physical health. And so those are the levers I would start to push on. And from a societal perspective, we have to have the mental fortitude as an organization of humans and government to say no to the corporations and the entities that are driving this system. Because it wasn't like this when I was in school as a kid. Food wasn't great, but it was real. It was prepared on site. There were cooks in the back. And we didn't have the obesity epidemic or the metabolic disease epidemic. When I started pediatrics in 1999 in private clinic, I don't think we had a single type 2 diabetic. 26 years later, I can tell you about an asthma pilot I just ran, and how many of these kids are either diabetic or on the glide path to diabetes. And so 26 years to change that fast means the epigenetic inputs, the mismatch is insanely focused against our kids.
You're speaking our language, and JP is not unfortunately here for today's episode, but he would absolutely echo your sentiment here. The goal of pregnancy is to have a healthy baby, right? And we want to prolong human existence. We want to make sure that the progeny is healthy and able to function well. But when the maternal parent is under stress, mental, physical, emotional, psychological, whatever form, even biochemical stress, it's going to initiate this state of hypervigilance. And that hypervigilant state pushes kind of the autonomic nervous system to decrease parasympathetic functionality and increase sympathetic functionality. And what that does is it essentially shuts down vagus nerve functionality, or it decreases the capability of the vagus nerve to function, and it increases the sympathetic nervous system activation, which is the fight or flight side of things. The downstream effect of that is directly on immune cells, because what the role of the autonomic nervous system is to tell the immune cells, are we under threat or not? And when the mother is under threat, when there is stress, just like the ice storm example that you gave, there are going to be downstream effects on the immune system of the progeny of the child. And those children then have hypervigilant autonomic nervous systems and hypervigilant immune cells. And those hypervigilant immune cells, then compounded with nutrition that's not the best, then compounded with screens that they're staring at all day long and not going outdoors and not getting fresh air, and maybe their genetics are not completely matched to the environment that they're growing up in, and the vitamin D levels are low, and all of these pieces are compounding, and what that's resulting in is an epidemic of these chronic conditions like type 2 diabetes in children, which is a crazy thing to think about and to say, and autism and anxiety and depression and metabolic dysfunction. All of these are at the root of them an immune dysregulation secondary to some sort of stressor, whether it's a mental, emotional, psychological, biochemical, or physical stressor. It's pushing these cells into that hypervigilant state. I want to get into this idea of the metabolism of these immune cells. And this is something that Jeff Bland is such a big proponent of, is immunometabolism. Let's talk about these immune cells and how epigenetics affects how immune cells function and what immunometabolism is.
So let's look at this from a couple different angles. First off, to your point, all mammalian species seek safety for thriving, right? So in a safe environment, the autonomic nervous system will tell the human that you're in a good place to digest, to grow, to thrive. In a sympathetic fight or flight mode, that's a good thing to run away from the bull. It was meant to be for all mammals to thrive and survive. And Stephen Porges says it really well. The ventral vagal system is a late finding. It's the one that allows us to be happy, peaceful, and in a great place. That is conducive to an immune system that is regulated and not inflammation based. In a dorsal vagal, to your point, that is the parasympathetic, but the shutdown mode, that is a very reptilian form. This is very old. This is the one that is basically where if some form of a reptile or a mammal is about to be eaten and they know there's no chance of getting away, it is better to shut off the entire cognitive system and just lay there and die without knowing it than to actually be eaten and have cognitive memory of this. And this is very adaptive. And this is well known by like an antelope about to be eaten by a lion. And the antelope is in the lion's mouth. And the lion gets scared away. The antelope takes anywhere from 30 to 60 minutes to move again. That's dorsal vagal response, to your point. The sympathetic one is the run and gun, right? That was meant to be acute and meant to disappear. From an immune system perspective, when you are running and gunning, the blood goes to your brain and your muscles and your heart. It shuts down your inflammatory system. It shuts down your gut function. It shuts down everything else because you don't need that to survive. When you're done, you get away from the bull, everything can turn back on. If you die, it doesn't matter. So the immune system is set up to not function primarily during the fight or flight mode, right? Now, this is where I think your point comes really interesting. If you get stuck in sympathetic overload, if you get stuck in fight or flight, if you get stuck in chronic stress, either dorsal vagal or sympathetic fight or flight, the immune system then actually shifts. And so from a chemical perspective, acute stress shuts off inflammation. And that specifically shuts off something called NF-kappa B, nuclear factor kappa B, which is a main player in inflammation. If you are chronically stressed, it actually becomes resistant at the receptor level. There's this thing called a P50, P51 dimer that's supposed to come down and shut off the gene transcription of NF-kappa B. Well, that actually reverses and now turns on full tilt. And this is why folks who have mental health disorders have very high inflammation rates. And we know this now actually because there's something called the systemic inflammatory index and the systemic immune response index, which are metrics taken from a CBC. And if you look at who has the highest baseline elevation in inflammation and an SAI, it's mental health. Why? Because that chronicity of sympathetic overload and or chronicity of dorsal vagal leaves you to have overloaded NF-kappa B, which then turns on IL-6, IL-17. IL-6 is a very big player in pro-inflammatory cytokine movement, including cranking up neutrophils and many other things like our active T cells, which then, what do? They're looking for things to kill. Why? Because that's, in general, the adaptive nature of the immune system. Now, this is in a constantly fluctuating real time, all the time, and different parts of your body, right? This could happen anywhere at any time. But if the milieu is elevated in NF-kappa B, it's going to be looking for things to upset, right? And so this is where everything gets upside down. So if you're pregnant, let's say, and this is where you're at, you're stressed out, you have a immune cytokine profile that is pro-inflammatory, NF-kappa B up, IL-6 up, IL-17 up. That is what is associated with autism, right? And fascinatingly enough, there is data that shows something called immune activation syndrome, otherwise known as maternal immune activation, MIA. If a mother has a cytokine profile that is elevated in IL-17, IL-6, and these other things, and she unfortunately gets COVID or the flu, the risk of autism in that child skyrockets. And the reason being is because the glial cells in the brain, which are these macrophages that are involved in many things, especially infection prevention and surveillance, but they're also involved in programming and education, they get turned upside down, they get angry, they get put into what's called an M1 phenotype, which is an inflammatory phenotype, which then leads to changing and rewiring of neural signatures and neural frameworks, which then we see of as a syndrome we call autism. But that's only one piece of this large, huge pie. And so the immune cytokine profile for me is ground zero for understanding where the risk comes from. It may be immune maternal activation. It might be diabetic-induced chronicity changes. There's a million things that can go sideways while you're pregnant. The underlying thing is, how is the inflammatory state set up? Is it in a chronic overloaded state? Is it an acute up and down mode, which is the one that's normal? Or is it just in the perfect ventral vagal, right? And so that's how I sort of look at it. I think Stephen Porges and Mona Delahook have done some incredible work looking at this space. You've done some incredible work looking at this space from the biology side of it. But from the pediatric side, that's how I start to see this. So when I see a mother who is pregnant and she's under stress, I'm asking these big questions. What are you doing to reduce your stress? Have you thought about, polyvagal theory? Have you thought about transvagal nerve stimulation? Have you thought about meditation? Have you thought about prayer? Have you thought about, all these things that, and again, there's a million of them that can all lead to this fundamental reduction in autonomic dysfunction that leads to immune polarity, that leads to inflammation, that leads to disease.
You're absolutely on point here. And you talked about these critical situations with the macrophages, the microglial cells specifically in the brain, and how they can be affected. There was a really interesting set of information that was brought up by JP at a previous episode where he talked about, depending on when the stress occurs during the maternal kind of 40 weeks, if it happens at a certain time early on, the risk of autism is significantly increased, versus later on in the pregnancy, the risk of schizophrenia is significantly increased. What this shows us is that there are these critical windows of development, like critical periods within the full developmental breakdown, that certain components or certain aspects, certain cell types are being programmed, being initiated, epigenetics are being laid down in those initial stages at a different pace. And so it happens in a phased response or a phased experience. Talk about some of these critical windows of development or critical windows specifically, because if something happens in the first trimester versus the second trimester or in month 7, there's going to be a different response. Without getting deep into the woods, can you explain how these things work?
Yeah, so I think that, interesting enough, schizophrenia is a good example because it's the flip side of neurodiversity and autism spectrum. If you look at the data from the Dutch winter hunger study, when folks couldn't have access to food and they were starving, there was a much higher risk of autism. Much higher risk of schizophrenia. Autism turns out to be the opposite side of that coin. It seems to be associated with overnutrition, right? When that happens to be regulatedly important appears to be primarily first trimester. It is the most critical time, and that's probably because that's where most of the genesis of the brain's growth happens, right? So if you think about your a zygote, right? You have, mom and dad come together and you make this first human structure of 2 cells, and that's rapidly replicating. Then all of a sudden you have that neural tube. Then all of a sudden you have this forebrain. That's where all of these wires are starting to occur. So if you think about when's the most critical period for when these attachment wiring is going to happen, it's going to be that first trimester. Everything after that's going to be exponential growth of wiring. And so things can happen along those paradigms that when things go sideways too. But man, there's so much happening in that first, 3 and a quarter months that's to me the most critical piece of this story. In all my reading, every trimester is important. But I think if we're going to pick a layer of time, first trimester is the most important for me of all the stuff I've read. And so fundamentally, what does that bring back to the epigenetic story? Preconception. If we're really going to go anywhere as a time frame to say, where do we intervene in human existence to try and stem the tide of all disease, not just neurodiversity, all disease, we have to go upstream 1,000 days before the first zygote is made. And the reason being is because you have to set the table for mental, physical, nutritional, toxin, sleep, circadian biology. All of these things need to be put into place so that we have the best outcome. And again, when I mean this, we're not saying this from the structure of the ability to stem every possible risk. We're just trying to give every mother the best chance she can based on her host genetics in order to allow the epigenome to function according to the best outcome for her and her child. And I'll say this, and this has to be really, said out loud and continuously. Everything we talk about is never to make a mother feel upset about discussions that she's had around her life in the past. I have so many mothers who are upset about having a C-section. You know what? That's life. What we have to care about is today and what we do tomorrow and what we can do every day moving forward. Having guilt in the past, I'm not a big fan of that. I think this is about education, about empowerment, about strength for women to choose the best path they can for themselves and their child. And for men listening, the best thing you can do is to support your woman and her offspring by making her world the safest it can be on all levels, right? That's how I sort of look at this. And so structurally, I would say first trimester is the most important, and I would equally divide second and third trimester. I think, again, when you talk about infections, they're important in all three trimesters, but again, first trimester would be the most dangerous. Think about things like torch infections. That's when it's the most risky. Is if you get a torch infection, and that's toxoplasma, a CMV, those things, first trimester is the most dangerous.
Yeah, of course. And that critical window of development matters. But you mentioned something that I really want to dig into, and I want to ask a question on this. We've heard a lot about the first 1,000 days beginning at conception, but you talked about the 1,000 days prior. And I love that you did, because what you're trying to do in an ideal scenario is set the table exactly right. You want to initiate feelings of safety, of calm, have immune regulation taking place, autonomic regulation taking place, have a mother and father. There is apparently some unique inputs that the father that is regulated provides about 20% of the regulation in the child later on, even just from a genetic standpoint. So there is a lot to be said for the paternal side of things here as well. But those 1,000 days prior is where the table is set. Do you feel like this is where the social determinants of health play a huge role in those 1,000 days prior to? Not only obviously it will during the developmental phase and in those first 1,000 days of life, but in those pre 1,000 days, social determinants of health must play an important role here. If maternal safety from a financial standpoint, from a social community standpoint is not there, we're not setting the table as well as possible. Is that true?
Yeah, 100%. Let's think about it from the perspective of conception. Regardless of what you believe, nature versus God versus whatever, there is a plan in place that says if the mother is not fit to have a child, she will not conceive, right? So you could see this with something like PCOS. You could see this with something like incredible mental stress. You can see this in a lot of different cases. Think about the ultra marathoner. She's running a ton. What happens to her period? It disappears. Why? Because she doesn't have enough maternal body fat in order to carry a child to term and breastfeed. So the system shuts down and you are not allowed to have it. And so the system was set up to help the child be brought into a system, maternal system that is allowing the child and the mother to thrive. In the absence of that, pregnancy will not occur. Fascinating enough, let me tell you some examples. So I've had many, many experiences with mothers who could not get pregnant, and then they adopt. And then within 3 months of the adoption going through, they have a natural child. Why would that be? Well, simplistically, once they have a child on the way that is not their own, their stress about having their own child disappears. And now when they have intercourse, they're relaxed. They're enjoying the process. They are just allowing physiology to play out. Boom, they get pregnant. And so that tells me maternal stress mentally is massively involved in allowing a pregnancy to come to term or not. And that's not a one-off. Hundreds of times I've seen that happen. And so to your point, SDN is massively involved because what makes people stressed out? Financial responsibility, right? Huge. Relationship experiences, huge, right? Physical ability to have food on the table, huge. And what's happened in America, unfortunately, and mirrored in many of the industrialized countries, I know Canada, not as bad as us, but not far behind, is that processed food has become the norm for most people, right? So what used to be a world where 500 years ago, if you were overweight, you were rich because that meant you had access to tons of food and you could eat ad nauseum, and so you could gain weight. Now it's the flip-flop. Now if you're overweight in this country, it's actually the poor who are, because their access to food in food deserts and all these other places is mostly ultra-processed, highly caloric, nutrient-poor food. And so we flip-flop the narrative. That's the one that's non-conducive with developing a good human immune metabolic system. And so SDN is at the core of all of this. So to your point, 1,000 days before conception, if I was, I was thinking about Star Wars. Interesting enough, I'm a huge Star Wars fan. And when Anakin Skywalker is talking about the Senate being so dysfunctional, he basically says, I should run this thing. If I ran it, everything would be done right. I have some understanding of that, right? Like, it's not the way it should be, because then if somebody is in that power, they could do damage like you see in some of these other countries where there's a dictator. But at the same point, If the government in our country is not doing its job because it's got corporate capture of the senators and different things, our country is struggling. So maybe there is a point where we say somebody's got to stand up and say to, like, again, non-political, but a MAHA movement saying we need to get rid of all sugar and all ultra processed food in kids. I'm 1,000% behind that. Apolitical to who's doing it, don't care. But that's something I can get behind, because that says to me, hopefully will change the paradigm of food inputs preconception into the child. Because again, epigenetically, I think it's affecting the kids the whole way, right? Immunometabolically, leading to mental health disease and all these other things. So yes, yes, and yes.
We would be remiss if we missed this particular topic as part of this, and that is the microbiome. And we know that the microbiome plays such an enormous role in our overall determinants of health and our longevity, our health span, all of these pieces to the optimal health puzzle. Let's talk a little bit about microbiome. There's a lot of great research being done more recently, particularly from a few different companies. One that I'd quickly like to shout out is Tiny Health. I think they're doing a great job on helping people understand what the microbiome should look like at different ages and different stages of life. And that, for me, I think is a really important factor. Let's talk about what the microbiome affects and how, and I'm specifically talking gut, but we could talk all areas of microbiome. And what should we be looking for if there's a parent listening, if there's a clinician listening? What are some of those critical things they should be looking for in the microbiome of a child?
So think of the microbiome as a rainforest, right? So if you think about monoculture farming versus polyculture farming, like a rainforest. Monoculture farming, when you put corn in a humongous field and you leave it there, because there's no other plants, there's no ability for cross species to protect against pests and pesticides. So therefore, the organization that's building the farm has to throw tons of pesticides and fertilizer into that area, because you've taken away all these other competing forces. You go to the rainforest, there's thousands and thousands of species of animal and plant all there, and they work in this ecosystem of unison to thrive. And that's how rainforests thrive incredibly well, with diversity, color, all those things. The microbiome is identical. If you have a diverse microbial makeup, and for this purposes, we're going to talk about bacteria, but there's more than just bacteria in the gut. But for this purpose, we're going to speak to just gut bacteria for what Tiny Health is actually testing. And what we find is that folks who have an incredibly diverse microbe makeup inside their gut, their disease risk goes down, down, down. And this is especially as it relates to metabolic disease, immunometabolism, and excess weight gain. And so when somebody does an analysis on, let's say, a maternal microbiome or child's microbiome, if you find that the richness and the speciation is very low, that's a highly metabolically, immunometabolically risky human, and they're more likely to have disease burden. And we know that this is actually consequential to the child, because in animal models, if you take the microbiome from an older human, which has less biodiversity in it, microbial diversity, and you transfect it into a younger pregnant mouse, the children of that mother come out with actually increased neurodiversity, anxiety, all these mental health issues. So that's in an animal model, which is fascinating, right? Well, this is also thought to be the same thing that's happening in humans. So from a mother's perspective, when you look at this, you'd say, okay, what do I want my child to have in order to not have a disrupted microbiome? And what can I do to prevent my microbiome from disrupted, assuming nothing bad happened in the past? And those bad things could be chronically eating American food, overexposure to antibiotics, antacid use, chronic mental stress, lack of exercise. I mean, it goes on and on and on. There's so many things that affect the microbiome. Let's say we're starting at this one moment in time. How do you adjust going forward? Well, then you'd want to eat a highly diverse diet, loaded with very different fibers. And that would be, to me, what they talk about loosely as a Mediterranean diet or anti-inflammatory diet, because you want to put in all these polyphenols, which are food for the gut bugs. You want to put in fiber sources, which is food for the gut bugs. That then starts to feed the ones that are there. If you've had a really dysregulated microbiome in the past, then it's a good idea to get a Tiny Health test or a GIFX stool test to see what's in there, because you might actually paradoxically have to kill some of the bad guys with antibiotics or herbs that help kill the bugs. So then you can actually feed the gut that's there and build it back up naturally. So that's sort of that paradigm of the maternal microbiome and the child's microbiome. But the most important thing a mother can do out of the gate from birth is breastfeed. Why? And this again goes back to evolution. Humans always had an issue with access to food. food scarcity was a norm for most of human history until the last 70 years, roughly, right? Mothers take around 8 to 15%, depending on the study you read, of their energy intake to make human milk oligosaccharides, which is fancy names for these sugars that mom's milk produces that then goes to the baby and only has one function, to feed the bacteria inside the baby's gut. So if mom's taking that much energy to make this product inside her milk, that must mean it's super important. We now know it is. These diverse microbial species release these that eat these HMOs, then kick out all of these chemicals that the baby's enterocytes, gut cells utilize to build natural human host function. And the key word here is going to be tolerance. Those microbes help the immune system be polarized towards being tolerant to everything else, right? And by everything else, I mean pollen outside peanuts, eggs, all these other things that allows that child to have a gut that leads to normal immune metabolic functioning, right? So I think of all of those things as microbiome matters tremendously, and how there's so many things involved. I mean, if you just look at the Stein study, Amish versus Hutterites in New England Journal of Medicine, I think it was in the late 90s. They looked at, this is fascinating. They looked at it and said, okay, what happens if we check the endotoxin level, which is a fancy name for the gut bacterial cell wall debris in the dust of the homes of these Germanic-centric tribes that live in the United States. So the Amish, everyone knows very well, are folks that live on single-family farms in multiple different parts of the country, including a big one in Pennsylvania. And then the Hutterites are very similar genetic population, but they live on mechanized farms where the periphery is where the families live in their homes, but the farms are all centralized. So the endotoxin level is much less in the homes of the Hutterites versus the Amish. And they took those dust volumes and gave it to animal models that were prone to asthma and allergies, and said, what happens if we give the dust to the pregnant women and the babies? And what happens? Well, lo and behold, the dust that was exposed from the Amish homes to the children of the animal models did not develop asthma or allergies. If they were given the Hutterite dust, which had low endotoxin level, which is a euphemism for low animal exposure, bacterial cell wall debris from the animals, had a higher level burden of asthma. So that tells you they had a break in tolerance, the ability to see the outside world as normal. They did. And so that brings in animal microbial exposure, feeding the gut microbiome, feeding the skin microbiome, feeding the lung microbiome. And so I would put all that out there as a long-winded answer to your question. The microbiome is critical to everything, not just asthma and allergies, but ASD, ADHD, everything. And you want to feed it good food, breast milk, good animal exposure early on, let your dog lick your kid, blah, 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 all the way down the line.
Get outside, do all these things. I think these recommendations are focused on building biochemical safety, right? Because that's ultimately what we're meant to work symbiotically with the bacteria and every part of, I like to talk about bacteria, parasites, viruses, yeast, and worms in the microbiome. And we need to live symbiotically with them. They provide short chain fatty acids. They provide, they break down colostrum and allow for the leakiness of the gut to go away in adults and keep it present for children. And on the leaky gut topic, I just really want to make sure that people know this. When children are young, particularly in that breastfeeding age, their gut is leaky on purpose. If we are providing poor nutrition during that period, we are enabling more of those toxins to enter the body during that critical period. And that is setting up for failure down the line, right? It's setting us up for immune activation, immunometabolism issues. It's setting us up to go into this hypervigilant state from a biochemical stress point. This is a critical time. Feed your children as whole foods, clean foods as possible, period. I think that is an ultimate takeaway from this particular part of the conversation.
Yeah.
This
Can I add
has
something?
been huge. Yeah, please.
So fascinatingly enough, Engelhardt et al. At Duke did a study a few years back, I think it was 21 or 22, where they looked by machine learning at specific characteristics of risk for ASD. And they found they could pre-predict roughly 1 in 2 children at 1 month of age, whether they were going to go on to have autism at a year or 3 years, based on a set of criteria, including preterm birth, preeclampsia, prematurity, and then exposure to issues related to colic, gut dysfunction. They also looked at referral to therapists. And this whole cadre of things led to an analysis that said syndromically they can figure this out at 1 month of age, which again goes back to my earlier comment. This is preconception. This is pregnancy. This is not post-conception. This is not vaccines. This is not all those other things people talk about. But fascinatingly enough, in 1999, I started in Salisbury Pediatrics. And I would venture to guess, and I don't have hard data on this, but it was around 1 in every 100, maybe 150 kids that would come in to see me as a newborn would have a failure of cow milk protein intolerance. So they would have to choose a hydrolyzed formula because they were unable to handle, from a tolerance perspective, the milk protein called casein, which for folks, if they don't know, whey and casein are the two major proteins in milk. And the cow milk has a much higher casein load than human milk. Human milk is much more whey-based, but they're different proteins because one's cow-based, one's human-based. But that being said, children used to tolerate this really, really well, even though it wasn't the same as human milk. Well, fast forward to now, 1 in 4 roughly of the children I see in our clinic are not able to tolerate regular formulas. And so we're using abnormal volumes of hydrolysate formulas, which means the proteins have been broken down so the immune system can't recognize them and can't cause the diseases. To your point, leaky gut. If you are reacting to milk early on, you have colic, green stools, eczema often, spit up, having problems. But to your point, what's really happening is a lot of inflammation in the gut. These kids actually, if you test their stool, they have blood in it. Why? Because it's a colitis. It's actually an inflammation of the gut lining. So what is that leading to? More leakage, more proteins falling through into the subendothelial layer, which is where 70% of the immune system's sitting, ready to learn right from wrong. Oh, by the way, it's a wonder these kids have more atopic disease. No wonder they have more food allergies. Wonder if they have more food intolerances. Well, you set the table early on. And all of that, I think, is being driven by gut microbiome dysfunction, pregnancy-wise. And so they looked at humans and they found that women in this country have roughly 10% have a very specific bacteria called Bifidobacter subspecies infantis. It is the only known microbe that has all of the genes to consume all of the HMO, which is fascinating, right? The bacteria can elaborate all the genes from itself to produce the enzymes that allow the bacteria to eat all of the human milk oligosaccharides from mom's milk and then spit out all those short-chain fatty acids you're talking about. Well, if 90% of us don't have it anymore because of various reasons of antibiotic exposure, diet, everything else, that means we're not even consuming the HMOs when we do breastfeed appropriately. So there are some probiotics now out there that you can actually take this back. But fundamentally, it says, again, that tolerance is being broken tremendously in our industrialized population because we're not attending to the things that make upstream choices for tolerance in the right direction. And so we're seeing more disease primarily because there are so many levers being pulled in the wrong direction.
Yeah, this is huge. And it's part of this holistic approach to creating and supporting optimal development in our kids. And I think this is huge. And I'm a parent, you're a parent. I would want to ask, in your experience, you mentioned very briefly vaccines as one of the things that's been looked at when it comes to this idea of potential neurodevelopmental effects. Obviously, that's been brought to the forefront more recently. I simply want to ask your experience. Have you noticed if there is a correlation in your practice with regards to vaccines playing a role here?
Yeah, the answer is no. Huge practice, 19 providers, thousands and thousands of kids every year, thousands and thousands upon thousands of vaccines. And I've had exposure to non-vaccinators, partially vaccinated, alternative schedules, full-time schedules, everything. And in my experience, I've not seen a signal. I've never actually personally seen a post-vaccine within 30 days regressive autism. Haven't seen a single one. I've had patients come to me for integrative medicine that have had that happen, but I've never physically witnessed that event to occur. So I am dubious of those claims. Now, I am 100% for a prospective study to look at this. I talked to Paul often about this on my podcast, and he was against it because he thinks it's unethical to have an unvaccinated group in there. And I think that's wrong because I think they're going to do that anyway. The parents are choosing to non-vaccinate, so let's just use them as a control group to follow. And then we can answer this question. Safety in vaccines in the first 30 days is incredibly well established. Safety in combination and safety over time has not been established at all. And we do not know that. And so therefore, we cannot say without a shadow of a doubt that the additional vaccines over the time hasn't made an untoward effect on humans. We don't know that. I don't think it is, but we don't know that question, right? So let's just put that out there. But in my mind, do vaccines cause autism? I think the answer is categorically no. If you bring in things like Tylenol, I would not take Tylenol if I was pregnant. I think there's enough smoke there that there could be a fire. It's not It's not causation. It is potential correlation. I think Tylenol is actually a euphemism for maternal inflammation. I think women who take a lot of Tylenol are more likely to be inflamed, and that is the root cause of disease. So I think Tylenol may be a confounder that's showing us the window into the fire, but I don't think Tylenol is the problem. But Tylenol does block glutathione. Tylenol does have effects on humans because it's oxidized very differently. There's three pathways: sulfation, oxidation, and glucuronidation in children to break it down. And children who are prone to autism have a break in, if I remember correctly, it's a sulfation pathway. And so if the glucuronidation pathway is being blocked, then you could theoretically have excess oxidation. That's not good, right? There's a chemical that's released that I'm blanking on the name. I wrote a huge newsletter about this. But fundamentally, I think there's enough smoke there to say no. But again, coming back to the paradigm of what to do, I have two children, to your point. They were fully vaccinated. And my wife's a nutritionist, so she was way ahead of the curve on taking care of herself while pregnant and all of these things. So I'm going to fall back until there's better data. That I'm not going to look at the vaccine story right now. I would love to see the prospective studies comparing those three groups. But right now, I'm pouring all of my energy into immunometabolism, maternal health preconception.
Yeah, I agree with you there. I definitely, for me, I think there's a cumulative effect of multiple factors playing this role, and how you set the table in those 1,000 days prior to what's going on during development, during the fetal development phases, what happens with the microbiome, the like C-section versus vaginal birth, nutrition. There's so many factors.
Tons.
And then we haven't even talked, like we spoke about it, but just not right now. Mental stress. What's going on with the finances? What's going on with, relationship stress? What's happening in that environment? And I think we need to start looking at clients the same way that you are in this very much N of one experience. Let's work with one person at a time to help create an environment that helps them as parents and their children thrive in the environment that they're choosing to live in. And let's work together to create that from a holistic view, I think, more than anything. I want to work into wrapping this up because this has been chock full of wonderful information. And I think the key here is nobody's to blame for any of this. I think no parent should blame themselves if their child is dealing with a developmental health issue. Most likely scenario is you truly didn't realize or you truly didn't know that it would have an effect, or things that were happening outside of your experience or your control were causing certain challenges. So ultimately, I think the goal here is let's empower parents, let's empower caregivers to create a positive environment. I'm going to hand it off to you to wrap it up with some final thoughts.
Well, I'm going to push back on that a little bit. I don't think we should say there's no blame. I agree with you. There's no blame for the parent. I think if you didn't know, you should never look at yourself in the mirror and have blame or shame. That's useless, not acceptable. There is blame to be said at the governmental level, and there is blame to be said at the corporate level. I think there has been absolute corporate malfeasance around the production of ultra-processed food and the dissemination of that to our parents and children who have high SDN needs. Just look at SNAP programs where you're allowed to buy soda. I mean, that's unconscionable, right? That's like essentially saying it's okay to have cocaine. Immunometabolically, it's destructive beyond belief. So I am the kind of person who probably would be assassinated if I ran for president, because I call a spade a spade. I am not okay with the current world that exists as we poison ourselves and then say Ozempic is the answer for whatever immunometabolic is going sideways. So that's number one. If the government is involved and they're giving money towards a process, it should be only towards the child's health. If it doesn't, I have a simple saying in our clinically integrated network: if the child is not benefiting, we don't do it. Simple, end of story. If you're bringing something to my organization and the child is going to lose or is neutral, I'm out. The child needs to benefit, because that's who brings our society to the next level. If we don't prepare for our children to do well, what kind of society are we? Literally, it's like, I don't want to live in a society that says children don't need to thrive. That's wrong. So I would call that out all day long. Fundamentally, to your point, though, I think education for every parent, whether it's mom or dad and the child, has to be forefront of our plan moving forward. And podcasts, I think, is the greatest thing ever because this is the democratization of information. It is free. You're doing this out of your own goodwill, and that's the right thing. And you being the vagal nerve specialist, you know that what you're actually doing is you're calming people. By giving them information, they have the ability now to take that information and go, okay, here's my movement forward. And I don't need to look in the mirror and be upset at myself. I can say this happened, and now let's be proactive to the hope side, the epigenetic piece that says there's hope here. Epigenetics proved that. We know that, right? So let's take the hope story with us everywhere we go. And I love Jeremy Goldberg was one of my podcast guests who has a website that's awesome called Long Distance Love Bombs. And Jeremy was a hardcore scientist. He decided he wanted to go back around the world and give out love. And what he does, he writes down pitchy statements that are positive and leaves them randomly somewhere and doesn't wait to see what happens. He just disappears and it's a tree fell in the woods. Did it fall? I don't know. But that to me is what we should all be doing. Like giving away information, don't ask for anything in return. Just give it away and hope and pray that people learn and become, the best epigenetic versions of themselves with no need for anything in the comeback, for no shame, blame, any of it. This is all about giving love out through information. And I'm just grateful that you're putting your world out for everyone else to see, your vagal experiences, all the stuff you do. I mean, it's phenomenal. I mean, I've been following Stephen Porges for a while, and I ran into Mona Delahook, who I loved. I know your work, so keep doing it, keep giving away your love, because that's why I'm here. I want to be involved in your world and the beauty that you're sharing with everybody so that people can change that hope story.
Giving me like amazing vibes here. I very much appreciate that. This story of sending love wherever made me think of a very special thing that happens at my gym. I walk in at least 2 or 3 mornings a week to my gym where I go to weight train. And one of the lockers in the locker room in the men's area, it's not a fancy gym. It's nothing unique or special. It's just a place where people go, throw on your headphones and go work out. And somebody has, with a Sharpie marker on the back of one of the lockers, written, "You made it. I'm proud of you." And every time I walk in, I see it, and there's like this positive reinforcement of, yes, I did get up, I did go early, I did make sure that I got to the gym, and I'm here to make sure that my body is functioning better than it was yesterday and that I can maintain this. And the whole idea here was somebody dropped a love bomb and left and didn't care to see who saw it and who it affected. But yes, that made a sound in the woods. And so this is what these podcasts are. Yes, I would love for everybody to subscribe, and I would love for everybody to share this episode with 18 people that you think could utilize this information. But ultimately, I'm not here to do the one-offs and see what's happening. Let's drop these love bombs all over the place. Let's empower people to take back control of their health, to make better decisions, more educated decisions. And I appreciate you coming on and sharing your wisdom with us, because we want to build a stronger childhood. We want to build stronger people so that they can function and maintain our level of capabilities as long as we exist as a species. So thank you for coming on. Where can people learn about you, and what's the approximate timeline for the book? I know there's not a dead timeline, or a dead set timeline, but we want to make sure that when the info is out, people are ready to jump on it.
Oh, it's my albatross. I don't know. Hoping end of summer.
Okay.
Would be my goal to get it out. It's in written form. It's just I'm a perfectionist to some extent, and right now it's still taking time. But anyone who wants to learn more about what I'm giving away, SalisburyPediatrics.com. There's a website, Health and Wellness Newsletter tab, gives you all the newsletters I've been writing for 16 years. Every week or other week now I write topics of preventative hope, right? So that's what it's all about. The podcast is Dr. M's Women and Children First. It's on Apple and Spotify. Everything is about this story. So the guests are all related to, in general, women and children's health, and something related to what's happening with them, what we can go upstream, how can we figure out how to unwind this preconception story. And that actually is my favorite hobby right now. I love talking to guests. It's just a blast.
I love it. This was an absolutely brilliant episode. I loved this conversation completely, and I really am appreciative and grateful for you coming on and sharing your brilliance with us. for everybody who got to this point in the episode, please honestly share this episode with 2 or 3 people who you think could really honestly utilize this information to upgrade their health. And we'll catch you all on the next one.